The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule history and physical. If you wait, it may be too late. To my military family, I got your six. To my Sonic brothers, the light is bright. Today's topic: most common health issues seen today. Over the past month, I announced that I am now taking no-fault patients. I am taking no-fault patients, so if you were involved, or your family member or a friend, loved one was involved in a motor vehicle accident, what we call MVA, think of me. You're going to get that quality care you really deserve, that compassionate care that you deserve. It's more than just pushing a pill. Anyone can push a pill. You want that compassion in that care, and I provide that. All right, so as I stated, the most commonly seen health issues today. One is physical activity and nutrition. Research indicates that staying physically active can help prevent or delay certain diseases, including some cancers, heart disease, and diabetes, as well as relieve depression and improve mood. Well, we know this because when you're working out, you have a rush of endorphins, and those are the happy drugs in the brain. It's so important that we want to make sure that those neurotransmitters are moving and performing at their peak. Inactivity often accompanies advancing age, but doesn't have to. So before we start a physical activity program, some exercise, going to a gym, walking, brisk walking, running, any active program, I strongly suggest that you should be medically cleared by a physician. Right? We want to make sure that you're fine, especially if you're getting older. We wouldn't want to push too hard, because if you have a family history of coronary artery disease, you have a history of high cholesterol, and now we start stressing your heart, and then we have an issue there. So you should see a physician like myself and have a thorough history and physical with routine blood work, and then be medically cleared so you can start exercising. It's just like when we're younger, we do like school physicals, what we call sports physicals. Even with that, we still see youth having issues and like sudden death. So as we age, the risk for that sudden death increases. I addressed this issue in a previous show, and that's overweight and obesity. Being overweight, obese increases your chance of dying from hypertension, type 2 diabetes, coronary artery disease, stroke, gallbladder disease, and so forth. what do we say? We know that increased weight reduces, longevity. Okay, so which I just mentioned there, but it also increases the risk for other diseases. We have what's called arteriosclerosis, or hardening of the arteries, that's associated with that. So let's define ideal body weight, overweight, and obesity, and then morbid obesity. Ideal body weight is the weight that we factor by your height versus your frame size. And then we also add on your musculature. So if you're athletic, then we can add on 10%, or if you're very petite, we can subtract 10%. So we look at your ideal body weight, and based on your ideal body weight, we say 10%. 10% is overweight. If you are 20% above ideal body weight, you're obese. That's right, obese. That's 20%, which is not a lot. And then we have morbid obese, which is 100% over ideal body weight. Again, someone's perception is obese is someone being extremely large. No, that's morbid obese. Obese is only 20% over ideal body weight. Again, before you start an exercise program, come and see me or see your physician and be medically cleared so we can decrease our body habits. We can decrease the weight. We can burn off those excess calories. All right, tobacco. I don't understand why the government allows the tobacco industry. Well, we know why. It's all about big farm, big money, big lobbyists paying people off. But we know how bad tobacco is. I mean, even in the early 70s when I was a little boy, as my father was a scientist, he taught biology, and we were discussing how significant the tobacco is when it comes to all sorts of cancer: lip cancer, tongue cancer, throat cancer, lung cancer, stomach cancer. Yet still, the government allows this product to be sold. Nicotine. We know nicotine, highly addictive, right? Okay. So they start increasing the nicotine percentage. Well, because we want to sell product, right? They want to sell product. If you look back a couple of years ago, you saw the little cartridges, what we call vapors, the vapor stick, or whatever you want to call them. I don't want to start naming names, but the little vapor, they have a little tank or cartridge attached to it that is filled with nicotine. And people, because it's addictive, right? It's the amygdala, the part of the brain. It's called the amygdala, and that's the pleasure zone, where anything that pleasures us, it sends a signal there, and then we have a little receptor, and it latches onto that, and then we crave it, and that's the addiction center, the pleasure zone. So now we have nicotine. Nicotine goes to that, and you want to continually stimulate the amygdala. Well, now the tank is filled with nicotine. And so when you walk around the communities, you see people huffing and puffing on these vapors with these huge tanks. In order to get that same amount of nicotine, you'd have to probably smoke 2 or 3 packs of cigarettes daily, because they made the access to the nicotine so easy because they can buy these tanks. You can even fill the tanks on your own. So now we have, a new way of fulfilling that addiction with the vapor, the vapor pens, the e-cigarettes. They're also called e-cigarettes. Well, that brought on a new medical condition, and that condition's called popcorn lung. That's right, popcorn lung. So people coming in with a new medical condition where they were seeing issues with the lungs because they were vaping all the time. And it's not just vaping, it's vaping, and they had different additives that are in the vape itself, and which developed a new medical condition, and we see it. It's called popcorn lung. All right, so now we have new immigrants that are immigrating to our community here, and we're starting to see actually past 10 to 15 years, and they're bringing their bad habits here. All cultures do that. I mean, it is what it is. I mean, there's no perfect society in the world, but they bring their culture here, and we have one where it's they're using the hookah, right? The hookah. So they're smoking. In their culture, they smoke that instead of cigarettes. They'll smoke a hookah. So now we have hookah cafes opening up, but we've done studies because a lot of kids, young adults, were being rushed to the ER after hanging out and socializing in these hookah cafes, and they were coming down with carbon monoxide poisoning. That's right, carbon monoxide poisoning. That's like putting your lips on the tailpipe of a car and just inhaling, all right? So carbon monoxide, not carbon dioxide, carbon monoxide poisoning, it's very, very difficult to treat. All right, so I have about a minute left. Let me see if I can, I might be able to do one more, and then we'll go into break. So substance abuse. Substance abuse usually means drugs and alcohol. All right, so we see the alcohol. We need to decrease that. Okay, when we know 2 ounces, it's suggested 2 ounces a day is healthy. But when do you start? When do you end? Especially if you're a power broker, you're going on these power meals, liquid lunches. You're trying to get these deals done. You start end up drinking more and more. It's called empty calories. And now you're taking empty calories in, and you're not burning them off because you're coming home and going right to bed, and you're not exercising. All right, so I have 25 seconds left to this part of the show. So come and join my practice. Let me help you lead a happier and healthier life. If you wait, it may be too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York, or give me a call at 631-980-8200. Welcome back to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, so both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it may be too late. Today's topic, we're going to continue with most common health issues seen today. As I just mentioned, I discussed physical activity, overweight and obesity, tobacco. We started covering substance abuse, so I'll continue with substance abuse. I ended off with alcohol. Alcohol, moderation. We always say moderation. It is suggested 2 ounces daily. After that, then we start having issues. You don't want to become dependent on alcohol, okay? Because alcohol, again, it makes you feel good, right? You get that little high, and then if you take too much, you feel sick. But during that phase where you're feeling good, we're stimulating the amygdala, the pleasure zone, and it's going to want to keep craving that. So in order to get that same feeling, you're going to have to keep drinking more and more because you build a tolerance, and that's what we're talking about, the addiction aspect. We go from use to abuse. All right, so we said drugs. Okay, we're seeing drugs on the rise in the suburbs. You see the kids with heroin, young adults heroin, so from heroin, you're seeing ecstasy. You got the club kids, ecstasy, acid. Now, because of society, we're dumbing down society, lowering the bar, and we want to normalize bad behavior. And all the kids, it's okay to smoke marijuana like it's a cigarette. Okay, I know in the South Bronx, where I used to practice, the kids were smoking angel dust, PCP. Yes, right, angel dust. And it makes you want to climb high, and then you leap off. A lot of kids, they would get on the fire. It's on the building where you have, at the stairway. If you have a fire, you can get out of the building. They'll climb up that and get on top of a car, and then they'll leap because they think they can fly. Angel dust. They want to get higher. Okay. They end up smoking it like cigarettes. Well, same thing. These kids today, with the marijuana. Again, I prescribe it for medicinal purposes. There's a reason for it. My mission is to make my patients feel comfortable and functional. All right, so we're seeing, like I said, an increase again in the suburbs. It's a different, generation. It's like we're reliving the 60s. These are the children of the 60s, the millennials. And so they bring on those same, brought up in that household. Not to get political, but this is the reality, and they're taking on those same behaviors. All right, so the next would be HIV and AIDS. We're seeing an increase. You think this is a disease of youth, sexually active youth. No, well, we're seeing an increase in the 50 or greater. 50 or greater. Yeah, people think, oh, you're 50 years old, you're not sexually active. Well, no, they're sexually active. 50, 60, 70 years, absolutely sexually active, but they a lot of them will practice unprotected sex. So we're starting to see an increase in HIV and AIDS. So let's just define HIV so you know what that is. That is a virus. What that virus does is it wipes out the immune system, specifically the CD4 cell. The CD4 cell is the recruiter cell or the communicator, and it communicates to the rest of the immune system, and it tells it what to do. So if we wipe out the communicator, then the immune system doesn't know to address the virus itself, meaning attack it, kill it, and remove it from the body. So then we have AIDS, okay? Before we get into AIDS, let's go into viral load and the CD4 count. As I just mentioned, the CD4 is the cell itself, and we know there should be a certain amount of CD4 cells within the body. We measure that. When the CD4 cell count starts to decrease, then we're starting to have problems with the immune system. We become immunocompromised, okay? So viral load is the percentage and number of viral particles floating around in the blood. Now, we have an inverse relationship between viral load and CD4 count. When the CD4 count is high and the viral load is low, that is what we would consider more of a healthy state. When a normal state would be a zero viral load, meaning I don't have the virus and we have a very high CD4 count. However, our mission, our goal to treat patients that have HIV is to drive that CD4 count as high as possible and to drive the viral load down to undetectable. So it's an inverse relationship. Now, when the CD4 count drops below 250, then we call it AIDS, okay? And that's when we start to see secondary and tertiary diseases such as the Kaposi sarcoma, meaning skin cancers. You're seeing all sorts of different types of pneumonias and other diseases, and that's what we die from, okay? The HIV, we can treat it, and you can live a relatively normal life, but it's when we get into the AIDS and we start to see the secondary and tertiary conditions associated with the disease because of the low CD4 count, that's where we start to worry because we can die from those secondary and tertiary medical conditions. So I'll give you a quick little story. We have about 3.5 minutes left. Again, as you're aware, I trained in the South Bronx. I was in St. Barnabas, and one of my attending physicians, he was on the World AIDS Board back in summer 96. And this is when they came out with the new protocols, the cocktails. Up until that point, from about 1988, circa 88 plus or minus 87, 88, 89, we only had AZT and maybe one or two other medications. That's all we had. What the game changer was when they were really working hard, pumped a lot of money. The government pumped a lot of money into treating HIV, and that summer '96 they set new protocols where we had the HIV cocktails, and that was the game changer. Where we have people still surviving today, and how we treat today was based on those protocols. Of course, we have newer medications now. The virus developed a resistance to some of those meds, and they have to bring on new medications. So let's get into mental illness. All right, mental health. We know as we age, we see more mental health. Well, actually, we're seeing it because of COVID. We're starting to see a young generation in their teens and 20s that are having behavioral issues, specifically anxiety. They're constantly worrying. I don't know why. Stop worrying. Enjoy life. You're 20 years old. Be 20. Don't worry about everyone else. Worry about yourself. All you need to do is focus on who you are. Be the best you are. Be the best yourself. That's it. The best me I can be. That's it. That's all we ask of you. Get good grades, get a job, while you're in college or while you're in high school, focus. That's it. Don't worry about the rest of the world. The world's still going to be here. Remember, we survived this Revolutionary War, Civil War. We survived World War I, Korean War, World War II. We're still here. We're going to be fine. You're going to be fine. Focus and enjoy life. Next is injuries and violence. We're seeing injuries on seniors unbelievably increase, especially in the city. We're just seeing as people walk around taking bricks and hitting people in the head. What's going on, people? What are you thinking? We have to stop the insanity. So we're seeing a spike in senior citizen violence. That has to stop. We have to protect our seniors. See something, say something, get on top of it. You're seeing people being pushed in the subway. We have it on videotape. Come on, people. Be smart. Stop it. All right, so we have about 45 seconds left here. We have environmental qualities that is an issue, immunizations, and then we also have access to health care. They don't have enough time to cover all that because there's just so much information to cover with so little time to do it. All right, so you're looking for a good quality physician. Look no further. Give Dr. Tommy O a call. Go to drtommyo.com to learn more about my practice. You were involved in a motor vehicle accident. Give my office a call. You're going to get that quality care you deserve. Compassionate care. I'm going to take time, sit down, listen to you. Look, listen, and feel. All right, so give us a call, 631-980-8200, 631-980-8200.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.